Okay, my dear students, so the next disease in the list is chikungunya. Chikungunya is not a deadly disease. That is, it does not kill the patient. But the patient who suffer from chikungunya and the infection is severe, then they have painful limb deformity. Painful limb deformity, that is, the limbs, hands, and the legs of the patient will ache so much that it will get deformed, okay, and that may last for some months. The mosquito which spreads this disease or is responsible for the outbreak of chikungunya is Aedes mosquito, the same mosquito which is responsible for the spread of dengue. Yes, the same mosquito. And the problem is that when a person is infected by chikungunya, it's become very difficult for the doctors to figure out what kind of disease that patient is exactly suffering from, because of the symptoms and because of the same mosquito and the same symptoms which other mosquito borne diseases have. It becomes very difficult for the doctors to figure out what kind of disease the patient is exactly suffering from. Okay, the symptoms are very similar to other borne diseases. So fever symptoms are same: fever, headache, joint pains, etc. These are the similar symptoms which a person suffering from chikungunya has or will show. That's why it's very difficult for the scientists, the doctors, to figure out what kind of disease they are exactly suffering from. Okay, my dear students, chikungunya is originally from Africa. So this disease originated in Africa and it came to our country in 2006. That is, the doctors, they reported the cases of chikungunya and the major outbreak of this disease was observed in the states like Gujarat, Andhra Pradesh, Maharashtra, Madhya Pradesh, Tamil Nadu, Karnataka, Kerala in the year 2006. So in a nutshell, chikungunya is not a deadly disease. That is, it does not kill the patients. But if the infection is severe, if the infection is very much, then the patient will have to bear painful deformed limbs. Okay, so the limbs will ache so much that it will get deformed, and that may last for some months. No vaccine is available. Vaccine is not available for chikungunya, not a specific medicine is available. As you have seen in the case of malaria, it was available. So vaccine is not available for chikungunya. So what the doctors they do, if a person is suffering from chikungunya, they just they just prescribe medicines for treating the symptoms. So if the person is suffering from fever, they will prescribe a medicine to get rid of fever. If the person is suffering from headache, they will prescribe analgesics. If the person is suffering from joint pains, they will prescribe medicines like paracetamol and analgesics. Okay, hope you understood.